and where you shadow one or two or a group of physicians and you really learn how they do things on a day-to-day basis. It's not just a week or two or a month of training. You learn when things go bad, how to fix them. You learn the little nuances of plastic surgery, which in plastic surgery, that is everything, like knowing the details. So it's super important to make sure that your physician is board certified, and is fellowship trained. Hey guys, it's Dr. Samir Undavia from NJENT and Facial Plastic Surgery. And today I wanted to talk to you about finding the right surgeon. So why is it important to find the right surgeon or the right plastic surgeon or the right provider for you? And the reason is that it's never a one-stop, you get your treatment and then you're done. It really is an experience. It's a journey. Things don't just happen overnight in plastic surgery. It definitely is an evolving process that takes time, and your experience matters and how you interpret your results, how you feel about your results. It depends on your experience. So finding the right doc matters. And there are tons of good doctors in our area. We're in the Philadelphia, New Jersey area, but in Philadelphia specifically, there's Dr. Becker, Dr. Schrader, Dr. Greco, Dr. Joseph Miller, Bucky. There's tons of great doctors in the area, but I have a little bit of an algorithm for how you find the right doctor. And believe it or not, it's about 5 steps, but the first one is make sure they're a doctor. You might think that's a joke, but it's not. There are plenty of people, especially doing injectables and spa things, where they are not doctors. They did not go through the whole accreditation process. They did not get training. Companies like Botox, Dysport, or the companies that own Botox and Dysport, Juvederm, Restylane, they have training programs where you don't have to be a physician to go learn how to use them. So you could take this weekend course, become certified, and then boom, you're ready to take care of patients. And, people who do that might be fine 50% of the time, 60% of the time. But when somebody's difficult or some anatomy is difficult, or when things don't go right, they really don't have the training to help take care of you from start to finish. So it's important to see a physician. And the second thing is you want to see a board certified physician. Believe it or not, there are plenty of physicians who have also taken those same courses that didn't get training in the specific area that you're interested in. So if you're interested in the face and neck, you want to make sure that they did residency or fellowship in that area and they did their board certification in that area. And the reason is we could do something 1,000 times the exact same way, and things might not heal exactly the same each time. You need to know what to do about it. It's not just about doing it right the first time. It's about watching it heal and making sure you can make adjustments during the whole process. The process is important. It's not just the one day of the surgery or the treatment. So make sure they're board certified. They passed all their tests. They've done that rigorous training. And third, which is a little bit of a nuance, but just as important, is that you need to make sure your person that you are seeing is fellowship trained in this particular procedure or treatment that you're interested in. And why is that important? Well, just like Allergan and Botox and Dysport, they put on these courses. There are people who are physicians that can go and watch somebody for a week or two or even a month and say that they got the training that they needed. And they can just take the board exam without getting the training. And the training is super important. And they might name drop on their website saying, I studied at this institution. But in truth, they didn't do a fellowship. And the fellowship is, number one, you have to graduate from residency. Number two, you have to then apply, go through an interview process and get picked to go do this fellowship. And number three, you have to spend your time with this program for at least a year, and where you shadow one or two or a group of physicians and you really learn how they do things on a day-to-day basis. It's not just a week or two or a month of training. You learn when things go bad, how to fix them. You learn the little nuances of plastic surgery, which in plastic surgery, that is everything, like knowing the details. So it's super important to make sure that your physician is a physician, is board certified, and is fellowship trained. The only exception for that is for injectables and skin lasers and stuff, where dermatologists have great training in their residency alone. So they don't need necessarily a fellowship afterwards. But when you're looking for a physician that is board certified and fellowship trained, typically facial plastic surgeons, oculoplastic surgeons, and general plastic surgeons. They've all got the good training, board certification process to be qualified to take care of you. Finally, so you've now qualified them as a physician. They're board certified and they're fellowship trained or qualified to take care of you. And you want to check out their pictures and their reviews. And reviews are important. Everybody has good reviews. What's important to note when you look at reviews is there a pattern? Even the greatest of surgeons have bad reviews. And it goes back to this point where you could do the same procedure 1,000 times and everybody's anatomy is different. Everybody's healing process is different. And sometimes it just doesn't heal the way you want it to. And you need to be able to approach your doctor and say, listen, I see this. Is this okay? What's going on? Do I need to do something about it? Should I be worried? And you want to make sure that your physician is approachable. A lot of times in reviews, you'll see that the surgeon was dismissive or they didn't agree with the patient. You want to make sure that, if that happens once or twice, that's not something to worry about. But if this is a recurring pattern in reviews, you need to be careful about that, because just like I talked about at the beginning, the plastic surgery experience, it's a process. It doesn't start and stop on one day. It can sometimes take over a year. It can sometimes take longer. It's a process, and you need to trust the person you're with to have your back and to listen to your concerns and to make sure they act on them. And then finally, you need to make sure that their pictures are good. Their before and afters. You want to make sure that they have the goals that you have in mind, and that your goals and their goals are aligned, and that they have good results. They can produce what they kind of promise or what they intend to do. So I hope that helps. If you have any other questions, reach out.